I'm David Brown, Director of the Virginia Department of Health Professions. Welcome to Virginia's core competency modules for pain management and addiction. These competencies were developed by work groups convened by Virginia's Secretary of Health. Over 24 experts in pain management and addiction compiled the essential competencies that Virginia's health professional students must acquire, not just our future physicians, nurses, dentists, and pharmacists, but the wide range of professionals who work with these types of patients. These modules, made possible by a Department of Behavioral Health and Developmental Services grant, present key parts of the competencies for use not only by our schools, but by practitioners already in the field. Thank you for your careful attention to this important information.
Hi, I'm Lisa for Arcan, Associate Professor of Psychiatry and Behavioral Sciences at Eastern Virginia Medical School, where I direct the addiction curriculum for the medical students, and I co-direct the Assistant Director of the Clerkship for Psychiatry, and I've been at EVMS for 26 years. And I'm going to talk to you today about Introduction to Addiction, Module 3. Topic 1 is Introduction to Addiction. The objectives for this session are that the learner will be able to explain the biopsychosocial model and its use in addiction treatment. The participant will be able to discuss the spiritual and behavioral aspects of addiction, and the learner will be able to explain the life cycle of addiction. What is addiction? Addiction is a complex condition, a brain disease, that is manifested by compulsive substance use despite harmful consequences. People with addiction, also called severe substance use disorder, have an intense focus on using a certain substance or substances, such as alcohol or drugs, to a point that takes over their life. They keep using alcohol or drugs even when they know it will cause problems in their life. And that's the American Psychiatric Association definition. Use and misuse of alcohol, nicotine, and illicit drugs, including misuse of prescription drugs, cost Americans more than $700 billion a year in increased health costs, crime, lost productivity. People are dying at an increasing rate because of addiction. So we're going to talk about the biopsychosocial model. It provides a comprehensive assessment that captures the biological, psychological, and social aspects of a person's life that is affected by substance use and improves diagnosis and treatment. The biopsychosocial model was started in 1977 by George Engel as an alternative to prevailing biomedical model, which views illness as a single source. The biopsychosocial model for addiction was developed in 1988 by Donovan and in 1990 by Wallace, recognizing addictive behaviors and alcohol problems as multidimensional. This model of healing and recovery emphasizes the complex interaction between the biological, psychological, and social, spiritual aspects of addiction. It attributes a complex phenomenon or events to multiple causes. This model takes a holistic view of the individual based on the biological, psychological, and social factors all play a critical role in human functioning in the context of disease and illness, and that health is more thoroughly understood in terms of a combination of biological and psychological and social rather than simply biological terms. This is a visual, detailed illustration of the biopsychosocial model to aid in your understanding. The social aspects of this model include relationships with their partner, their parents, their guardians, their friends, children, dependents, the disconnection from home or school, any disconnection they may have from home or school, poor academic or employment performance, underdeveloped social competencies, poor refusal skills or peer pressure, association with frequent alcohol and drug users, exposure to neighborhood risk such as crime, violence, and gangs, early access to alcohol and drugs, family conflict, early antisocial behavior, racial discrimination, or prejudice. So those are all the social aspects of this model. The psychological aspects include thoughts, feelings, behaviors surrounding by and generated by misuse or triggers. Difficulties regulating emotions, anxiety, depression, anger, etc. Early and persistent problem behaviors, learning difficulties, low self-esteem. And then the biological considerations are the genetic and inherited components of alcohol and drug misuse. Importance of alcohol and drug misuse at an age of initiation, the effects on the body itself, as well as the importance of nutrition, sleep, and exercise. In applying the biopsychosocial approach, the clinician should recognize the relationships are central to providing health care, use self-awareness as a diagnostic and therapeutic tool, decide which aspect of the biological, psychological, or social domains are most important to understanding the patient's health, and provide multidimensional treatment. Spirituality has been described as the very essence of who we are, the total of mental, emotional, and physical well-being. The spiritual life of the person includes their ability to be responsible, to be trusting, to achieve deeper levels of intimacy, and to realize his or her potential for growth. What constitutes our spirit is our ability to contemplate the purpose of our existence, ways to better ourselves, the delay of gratification, and to think about the long-term consequences of our actions. It is the spirit that enhances the individual's capacity to make moral decisions. It is possible to be spiritual without being religious, since there appears to be no innate human imperative to practice religion. Behavioral aspects of addiction, common characteristics you will see in patients and the reasons for many of the social and psychological problems that they face include lying, manipulation, criminality, shifting the blame, relapsing, withdrawal from those who love him or her, unreliable, unable to finish projects, losing control, inability to stop, cross-addiction, using to self-medicate, using without enjoyment, isolates theirself, and mood swings. The life cycle of addiction is characterized by frustration and internal pain that leads to anxiety and a demand for relief from the symptoms. The substance user is fantasizing about using alcohol or drugs or behaviors that relieve the uncomfortable symptoms. They begin obsessing about using drugs and alcohol and how their life will be when they use the substance. They begin engaging in the addictive behavior to gain relief and lose control over their behavior. They develop feelings of remorse, guilt, shame, which lead to feelings of dissatisfaction. They promise to themselves that they'll stop the behavior or the substance abuse. The life cycle of addiction is identified as a process in which addiction continually manifests in a person who is actively abusing substances. After a period of time, the pain returns and the addicted person begins to fantasize about using the substances again, and the cycle repeats itself. The cycle can vary from individual patients. Binge users rotate through this cycle more slowly, and daily users rotate several times throughout the day. Many times consequences arise that force the substance user or alcoholic to stop using, such as legal, financial, or medical or social consequences. Without any outside help, the substance use or addictive behavior is likely to return. Breaking the cycle of addiction. Treatment programs provide the needed therapy, education, and support to facilitate a process of change, establish goals to improve health and wellness, and help people suffering from substance use disorder live a self-directed life and develop meaningful life in the home, community, and to have the tools to stay on the road of recovery. Thank you for joining us today for Introduction to Addiction, Module 3 of this training series. And I'll be doing the next piece, which is the definition of addiction as a chronic disease. And then Dr. Peglow will be joining us for the third part, which is the addiction in primary care.